Hello everybody. First of all, thank you to Doris, Julie, Carmen and Angel for inviting me and organizing the event. When I asked Carmen last week whether I should prefer a presentation or not, she said no, it's just something casual, so just improvise. So I will try to do something like that. Even the title, which is Socialist Healing, I didn't put it, so I have something to discuss about it, which I think is a very powerful title because my background is a scientist. I was researching in the field of medical physics for many years in the UK. And when I came back to Spain, I started with this idea in my spare time of connecting patients. So more than connecting patients, I was thinking of sharing information that I thought it was important for patients so they could improve their quality of life. So with a scientific mind, I started trying to connect patients, gathering data, trying to see what were their symptoms, what they were taking, their age, etc. But I soon realized that it was not just about data. It was more important about social, about human beings and getting connected. Probably one of the most examples I'm proud of is Nuria, because as she was saying, a year ago she was just taking pills, staying home from 2 months to 2 months, and through our platform she just got introduced to this world, to some other people, and now she's giving talks in an international conference, so congratulations. So as I'm improvising, I think the best thing I can tell you is just the experience I had with Rett patients for the last 4 years. Okay, so as I said, we started this network with the help of my brother and some other full friends and family, as they say, the 3 Fs. We put together a beta web page in 2011 and saw that there was certain interest from patients, not just patients coming from Spain, but also from South America, the States, all around the world that spoke Spanish, okay? Because on internet the barriers are not geography, but probably the language. So that at the beginning was a challenge because we thought, okay, we are putting people from different nationalities, from different pathologies. This is going to be a very explosive cocktail. However, we were surprised because everybody connected really, really well. They didn't know where they were coming from or what pathology they had. They just thought, or they just knew they were patients, and they found there a connection link or maybe some dots that they started connecting to each other because they were probably missing some sympathy from their physical surrounding. Because when you become a chronic patient, it's quite different from when you're an acute patient. You're an acute patient, everybody gets very worried. You go to hospital, you have your surgery, you have your drugs, wherever. Hopefully you get over the disease in a few months and that's it, you are back to your life. However, when you are a chronic patient, it has a huge influence in your life. For the first few months, everybody take care about you, but after a while, they forget about it. They just get on with their lives and they forget that you were a patient. That's the reason maybe why in a platform like ours, they connect to each other so quickly and so easily, because they are missing that social part that they are missing in their real life. Apart from that, I think that movement, or that social movement between patients is very, very important because, as Nuria was saying, they know and they realize they can help and need to help medicine in the way that probably Sergio will tell later about participatory medicine. I think talking to each other, patient to doctors, not just doctor, maybe other people involved in medicine, there are many, is very important because in the 5 minutes they have, as she was saying, we have in our web page something called the clinical wall. We have the social wall and then the clinical wall. In the 5 minutes, she was very generous in 30 minutes, in the 5 minutes sometimes they have in the public system and they have to see a doctor. It's very difficult to tell them what happened over the last 3 months. However, if they have a diary of what have been happening or a photo scan with what they have over the past few months, for the doctor it's very easy to understand what had been going on for the last 3 months, and also for the patient to explain what happened, what they felt, etc. So the idea was to, I'm getting a bit lost, sorry, but the idea was to connect this part of the data with the social part and create some movement that could help patients and medicine. There is maybe in the way we interpreted this different with patient associations. Normally the traditional way it was patients got together through an association. Here in Spain that was between 5 to 7% of the population, of the prevalent population, which was, I think, not significant enough. I don't say that they've done a lot, but the total number of patients were not getting there. The 100% patient, the other 95, 93% of patients were not getting to connect to other people. By connecting, they respond to medicine in a different way that one person by itself could answer. What I mean by this is, for instance, when we try to liaise also with doctors, with industry and patients, because at the end our platform had to be supported by industry so far. And when we liaise with all of them, what we found is that if patients know what things are about, like Nuria was saying, you ask them whatever question industry has about quality of life, what they think about their reputation, about anything, and they respond very quickly and very honestly. And that's only happen if they believe they can support and help doctors or industry in developing new drugs or improving their quality of life. So, coming back to the title, Social is Healing, I think that that's my experience, that we cannot just be a 2.0 healthcare platform or wherever if we forget who is behind. It's not just the computers. I agree with Dr. Grossman that telemedicine is the future, but we shouldn't forget that behind the screen there is a person, and we also have to work the online and offline world. Okay? And that's probably why we are all here and not just having a Skype. Okay. So I don't know. What's the time?
Yeah.
That's okay.
Thank you so much, Óscar.
Right. Thank you.